Welcome to Health Live at Seniors Today. We are delighted to have here with us Dr. Padmalatha VV, who is a consultant obstetrician and gynecologist at the SPARSH Hospital in Bengaluru. Before I request her to speak, and the topic that we've given her is a very general topic on healthcare for senior women. Let me introduce her. Dr. Padmalatha is a consultant for obstetrics and gynecology at the SPARSH Hospital, as I mentioned. Her qualifications include the MBBS from Bangalore Medical College and the DNB from Bangalore Baptist Hospital. She has been trained in Gynaec, endoscopy, and obstetric ultrasound. She has rich experience in her areas of specialization. And before joining SPARSH group of hospitals, she was a consultant and DNB teacher at St. Martha's Hospital in Bengaluru and the Bangalore Baptist Hospital. She is proficient in the management of normal and complicated pregnancies and all gynecological procedures, including laparoscopic, hysterectomy, and vaginal surgeries like non-descent hysterectomy. Her special interests include high-risk obstetrics, obstetric ultrasound, endoscopic, and vaginal surgeries. Welcome to Health Live at CS today, Dr. How are you?
Yeah, I'm doing good. Thank you, Pradyum, for the warm introduction.
So the topic that we have and we invite doctors to speak about various subjects. I must confess that we've not discussed gynecological issues too many times. We've had just 4 to 5 sessions these last 250 odd sessions that we've had. Though we've discussed issues like incontinence, we've discussed topics like breast cancer, but specifically to gynecology, we have not discussed too often. I would request you to speak for around 10 minutes, give a broad introduction to the topic. And for all of you here, please ask your questions. We've got a new format that we have now for our health webinar. So ask the question in the chat window. Remember, we take questions only from people who are above the age of 60. And please mention your gender and your age so that we can, when doctor responds to the question, she can give a considered reply. Yeah. Over to you, doctor, and then we will start taking questions after that.
Thank you, Pradyuman. So when we come to this topic of women's healthcare beyond 60 or the senior citizens, a lot of challenges arise. These are the women who are generally having a lot of issues regarding their own healthcare and then their partner's healthcare and their priorities and their confidence in life and how they go about these things in their day-to-day life. So basically, when it comes to this, nowadays we see that so many people are actually going towards trying to achieve a good lifestyle and maintaining health. This is a very positive outlook about this. But generally, people kind of give up, saying that, okay, I am crossed, I'm above 60, I lived my life. What is there now? I have to just go on with my life and things like that. This attitude is changing and it should change further because each day we live should be lived with good, fruitful way and in a happy way and a healthy way. Happiness comes with health, right? So, in this, with this background, I would like to just insight to you about overall issues with women can face above the age of 60. So, these women above 60 are all menopausal, postmenopausal. So all the hormones which were supporting women's life previously, the estrogen, the progesterone hormones, which were helping her to live a healthy life, keep her bones strong, her muscle mass good, and keep her strength innate, will be coming down once this menopause starts, and that deteriorates with time. Beyond 60, the deterioration is further more, and in this context they have certain issues. We can say right from head to toe, if we take all the changes which happens, like hair loss, the skin changes, and the health issues. So the estrogen hormone is protects women against heart disease, against ischemic heart disease. You wouldn't have heard many women below the age of 50 having heart attacks. But beyond 60 years of age, these things increase. That is because the protective hormones of estrogen are not there, and hence they have the same susceptibility like women, like men of the same age. So once they cross menopause, so from there, then as you are coming down, you see the liver, the all the organs, they're all not having much changes if you're maintaining your lifestyle. When it comes to the genital health, because of lack of estrogen, there will be lack of immunity of the local tissues like vagina, and this leads to certain issues like irritation, burning sensation, frequent UTIs, especially precipitated after an intercourse. And these issues happen, and our women sometimes do not come out with the problems. They do not express and keep suffering in silence and really present. I've seen many patients coming with really increased symptoms only. They don't come when it is mild symptoms because of feeling a little hesitation to express this. And they can have genital prolapse because of the lack of supports. The uterus and the vagina can come down as a mass, and this happens mainly at this age. And they can have genital cancers like endometrial cancer, ovarian cancer, and some vulval cancers. These are common after this age of 60. These things should be kept in mind. And the worst thing is osteoporosis. Osteoporosis means weakening of the bones. The bones become porous. Osteo means bone, porosis means porous. So you can imagine a bone which is strong and solid will be able to maintain the weight, will be able to sustain any pressure, whereas a porous bone is very much susceptible to fractures. So the fear about osteoporosis is fractures. So nowadays we see that when all the other issues of health like diabetes, hypertension, everything is controlled, people beyond say 70, 80 have a small fall, and then they can have a femoral fracture or fracture of the spine, and then they get bedridden, and that is how the things may go wrong. So this can be controlled and prevented to avoid these fractures. I will be explaining to you more as to how to deal with this. And then there can be many psychological and psychiatric problems as well. People can have increased depressions because of the now they do not have their own parents most of the time, 60 plus, and so they are looking after their children, and they are the ones who are looking after. And when they feel their importance is coming down, these things can get precipitated, things like depression and other psychiatric issues. Again, uh, lack of insight and lack of care about it by themselves and by the family members can lead to detection of these issues in a very after a very long time, which is going to make it more difficult to treat. So recognition and treatment is good. Now these are overall overview of problems which women may face. Now how do we deal with it? The first thing what we should understand is uh, maintaining of health is the most important thing for anybody, especially at this age. So like if you have chronic illnesses, you have to keep them in control. Diabetes, hypertension, cholesterol, all these have to be kept in control. And lifestyle changes, like previously if you were not exercising also, you can start today. You can start today. Exercise, as in, it's not just walking. Walking is good to maintain your mobility, but what is more important is to focus on the muscle mass. Studies today show that we have to have our muscle mass. So the muscle mass protects the bones. So that way your mobility is good and your strength is good, and that reduces osteoporosis as well. So once the bones are strong, then the muscles are keeping them strong, then the chances of falls and chances of fractures both are reduced. and hence you can live a healthy and happy life. So exercise can be as simple as, even now at the age of 60, you can go for some kind of weightlifting can be done. You can go to the gym. You can have dumbbells at home, simple exercises which your own people can help, or personal trainers can help, or go to the gym and do it under supervision. Do not start anything by yourself. Do it under supervision. This way it helps. And then there are various ways of treatment of these vaginal issues. And the issues, the treatment depends on the symptoms of the person. If she is having burning sensation, dryness, irritation, dyspareunia, that is painful intercourse, then she can use local vaginal estrogen creams. There are certain contraindications for hormones in women above 60, but we have to keep in mind that many a times the advantages outweigh the risks. So this decision has to be taken by your attending physician, and then you can go for even hormone replacement therapy as per the particular situation arises. Regarding cancer screening, it's very important that certain screenings are done regularly, like cervical cancer. Cervical cancer can be prevented now with vaccination. Well, not above 60. Vaccination is a HPV vaccination. If it is done below 45 years of age, it can be helping in prevention. But cervical cancer screening must be done for all women, starting from almost 5 years after marriage or first sexual intercourse, every 5 years till 55 years of age, as per recommendation, where we are doing the HPV test and this. But if this testing was not done earlier, in seniors also, at least one time testing will help to categorize women who have a risk of developing cervical cancer. Regarding endometrial cancer, any lady who has any amount of bleeding after menopause, whether it can be spotting or bleeding or heavy bleeding or just bloodstained discharge, that has to be addressed with lot of care and a lot of seriousness, to check whether there is any possibility of thickened endometrium or the lining inside the uterus which can be thick, and that can be a reason for, it can be a risk factor for possibilities of endometrial cancer. Ovarian cancer, unfortunately, is very difficult to screen. However, it is advisable to go for once a year health checkup with an ultrasound, which can detect if there are any enlargement or any cysts in the ovary. That can help to detect this in some people at least. Then most important is breast cancer. Breast cancer screening is to be started from the age of 20, where we are doing, where the girl is supposed to do a self breast examination every month, and beyond the age of 40, she has to supplement that self breast examinations with mammograms once every 2 years. And the same thing has to be maintained by senior citizens as well. We would recommend mammograms every 2 years, and that will go a long way in detecting breast cancers when they are very small. And early stage detection can aim at cure in the real sense, where they finish their treatment, after that they live a normal life like others. So these are the few things which I would like to this. Can we proceed with the next session, Pradeep?
Yes, thank you, doctor, for a very concise and yet detailed discussion of what the issues are. We've got a few questions. Those of you who would like to ask questions, since the format is new, and you know, we will take all questions anonymously, yeah, so that you are free to ask whatever questions you want to ask. We will not reveal your name. But yeah, so this is it. We have a question which is on what is hormonal profile test and what is the cholesterol screening test?
Cholesterol screening test is the lipid profile which we do on empty
What is
stomach.
hormonal profile test?
Hormonal profile test is there is nothing called hormonal profile test, but we do hormonal tests for people who are like perimenopausal when we are doubtful about their possibility of menopause, or for people with PCO and these things, not in this senior age group.
Right. We have two questions on the same topic, which is, how often, and you mentioned this about the checkups that should be done, but uh, how often should one have regular checkups done? And, you mentioned after the age of 40, which is there, but is there anything specific that senior women should be doing above the age of 60?
Yeah, so senior women also should be doing annual health checkup, wherein we are screening them for diabetes, hypertension. We are checking for lipid profile, looking for cholesterol, looking for these general health issues, and an ultrasound which can see for presence of any fatty liver, presence of any ovarian cysts or endometrial thickness. These can be helping in detecting things even before symptoms can come. And then they can have once in 2 years mammograms. That is very, very important to detect breast cancer in very early stages itself.
Right.
And
There
osteoporosis screening also can be done, especially with people with higher risk. The people who are the people with higher risk for osteoporosis are the ones who are like generally thin and tall ladies, and who are sedentary, who are not doing much activity. Activity, simple walking also is a kind of weight bearing exercise, but it is very much recommended to do simple. Dumbbell lifting and these exercises to prevent osteoporosis. And vitamin D level screening will help in finding out people with vitamin D deficiencies. So vitamin D supplementation goes a long way. Almost we can say 90% of people in India are vitamin D deficient, and this increases the chances of porous bones and increases chances of reduced calcium absorption in these women. Hence, vitamin D supplementation guided by occasional vitamin D levels will help a lot in preventing these things.
Right. Doctor, we have a question which is osteoporosis hereditary? Does
Yes, it can be hereditary.
it can be
So
hereditary?
if you see people who had their mothers or their grandmothers who used to have hunchback, and they lose their height and bend forward, that is hunchback. That is a very clear indication of osteoporosis that happens because of collapse of the spine vertebrae. So these people should screen themselves for osteoporosis with the DEXA scans, and if it is showing high risk for osteoporosis and osteoporosis range, they need to have injections to prevent further bone loss, terapetide injections or zolandrix injections, and sometimes they may need HRT also.
Right. Doctor, we have a question about, what are how can women ensure that they get enough essential vitamins and minerals? And what would you recommend that their diet includes so that they get these adequately?
So it is recommended to have lots of fresh fruits and vegetables. Have milk without fat, so like skimmed milk. Have lots of curd and buttermilk. These are rich sources of calcium, and vitamin D is there in almost all this. More important is sun exposure. So go for walks, say beyond 10 a.m. Actually, the recommended time when you all have to go for a walking for better uh, vitamin D absorption is somewhere between 10 to 2 or 10 to 4, which is unusual time, but that is when the vitamin D levels will be best. And of course, vitamin D supplementation is almost universal. Once a month, vitamin D 60K tablet will be helpful.
Once a month, vitamin D tablets. And are these? There are also injections that are there. That are there. What is the recommended route? Uh,
For
I,
vitamin
yeah,
D.
for vitamin D. Yeah, that's right.
Vitamin D, I think even oral is good enough. It's not necessary to take injections. But if they are having very low vitamin D and if they are having osteoporosis, then injections may be required in certain women. You will get 60,000 units injections. So that can be given.
Right. Doctor, we have another question about hereditary. About is cervical cancer also hereditary?
No, cervical cancer is not hereditary. It
Cervical.
it happens due to HPV virus, and that virus is happens acquired through sexual contact, and that remains in a few people. Usually, it gets disposed of by natural immunity. When it remains or it persists in her system, then it can be a risk factor for cervical cancer. That is why even beyond 60, if they have not had any screening, at least one screening will help to see if they have a chance for developing cervical cancer later.
Right. Doctor, we have one question which I'm trying to figure. Okay, so this is a question which is about somebody who's age 56. We normally don't encourage these questions from non-seniors, but if the BMD test shows deficiency,
Yes.
does it mean that the gentleman is asking, does it mean that his wife, who's age 56,
Uh,
will get osteoporosis? And
if it is, it depends on what range it is showing. If it is range showing as osteoporosis range, then she's already having osteoporosis. If it is showing osteopenia means lesser amount of bone strength, but osteoporosis already porotic bones. So if it is showing osteopenia, then they have to by giving these medications, they will prevent osteoporosis.
right. So he's asked two more questions. Does one still need pap test and mammograms after menopause? And the third question is, what is better? Should one start hormone therapy or take natural supplements to treat symptoms of menopause?
Okay, symptoms of menopause can be of various ranges. It can be just minimal hot flashes for like 1 or 2 months and they get done with it. Some people may not have anything at all, but some people have such bad hot flashes they are unable to sleep, keep getting up in the middle of the night, like not sleeping, not able to carry out their. So it depends on the severity of symptoms. There are various ways of treating it. We treat with basic phytoestrogens sometimes, and then if it doesn't get better, then you have different levels. We have estrogen alternatives like tibolone, and sometimes we may have to give hormone replacement therapy also. So hormone replacement therapy can be given for short duration, like 1 or 2 years, to tide away with the menopausal symptoms. But the fallacy is once you stop it, again they will have for some time, and then it may eventually settle down. So it is definitely an individual treatment, and before starting on HRT, we have to do various tests to see their and background check, and then their history and their like mammograms and lipid profile and all these things, and go ahead and start with an informed consent. Because way back in 2002 there was a study which came up saying that hormone replacement therapy increases a lot of increases blood clotting risk, increases breast cancer, and sudden demise of these women, and hence HRT usage became very low. So before 2002 we used to give HRT to almost many people. I had myself prescribed to so many people. So after this study, the usage came down drastically. But now, later on, the following studies have shown that we need not panic so much, and it can be given for people, the chosen people who really require it, with the consultation of the proper physicians and gynecologists.
Doctor, can I ask you this question? You mentioned about the fact that one study was conducted and it
Yeah.
said, this is the right route to take. And then another study is conducted and it says, this is the right route to take. So,
Yeah.
so obviously, there is a bit of trial and error which is happening.
Yes. Hmm.
So, how do you ensure that, patients know what is the right route?
Yeah, so this is always a question, In fact, it baffles us also, where one day you have this study saying this, and after some time, this thing. But good trials are the well conducted randomized control trials, what we call. And later on, actually, when that WHI study came, which reduced HRT, later on we found there were so many biases in this study. So the following study showed that, but that study was conducted in such large scale in almost all over the many countries in the world that it had a major impact. So, and then then we as gynec doctors, we always want to ensure that we don't give anything which can cause a harm to the women. So, if you think logically, HRT will definitely help the women to some extent to reduce the osteoporosis and to reduce menopausal symptoms. But on the long run, once you stop HRT, again, this thing. If you think physiology, everybody has to have a end of the hormones by this age of around 50 to 53, 55ish. So if we are playing giving hormones in addition, how long can we give? Can we give it till their age of 80, 90? It doesn't make sense. So I feel that we have to use it judiciously in certain situations, and the decision has to be taken by overall discussion with the patient and the doctor, and sometimes physicians as well.
Right. Doctor, we have a question from one of our favorite uh, readers here who's asked this question in the past, but nevertheless, is it necessary to do a mammogram after the age of 70 as it is radiation? Would an ultrasound be
Yes,
safe?
yes. Mammogram involves both ultrasound examination as well as X-ray examination. So we can do one this X-ray mammogram. Once we can do this ultrasound mammogram. So ultrasound can be done every year also. There is no problem.
The other question is that should we take Shelcal daily or does it cause kidney stones in seniors?
It can cause kidney stones if it is not been excreted completely. So, and they again, this is a very controversial topic because so many studies have shown that sometimes these can calcium supplementation can lead to sudden MIs, and so many such things keep coming. So, as a balance, what we do is if people are osteoporotic or people are having uh, uh, indication that they have low calcium in them, we do the calcium levels in health checkups also. So, these people have to have calcium supplementation. I would suggest they take it either alternate day or take it for 5 days a week and 2 days break so that any excess will get excreted and then that will not lead to kidney stones.
And would you recommend that for people who do have calcium deficiency, they do look at from natural sources as well?
Yes, natural sources are good, but for getting the amount of, say, the recommended daily dose of calcium, you'll have to take at least 1 liter of milk or yogurt. So
Right.
that is very impractical. Not many people will be able to do.
Right. We have another question which has come in is if my B12 level is 85, how can I increase it? Will a Neurobion Fort tablet help if taken daily?
So what we have seen is when the B12 levels are very low, the body loses the capacity to absorb B12 when it is given orally. So that is somewhat going towards what you call as pernicious anemia. So in such people, when we supplement them with injections, the absorption happens, B12 levels get corrected. And some of them will regain the absorption capacity and later on they can maintain with tablets. Uh, but generally, B12 deficiencies, if some people have a propensity for that, they have to take kind of B12 injections once in a month for 1 year and followed by at least one shot every year.
Right. Doctor, for somebody who has a fairly good health, etc., what are the two or three things that you would advise, and perhaps you would also take for yourself? What are the two or three things that are a must do for every woman who is at the age of 60 and above?
I would say you should live your life. So for that, you should be mobile. You should not be restricted in your activity. start activity today if you have not done previously. Activity as in, you need to do simple things like walking, plus you can start some amount of weight training. I've been telling this throughout in this session, because I really want to insist on that. It makes a lot of difference. So people who are doing weight training maintain their bone strength, maintain their agility, and because of which they are able to, and also do group activities, do activities with people of your age group, go for outings. This will help a lot in developing, in enhancing your mental health as well, because mental health issues are one of the major issues in these age groups. So by doing these group activities, you can have a lot of positive impact. You will have sometimes outlet to your issues. You will have a lot of fun with people of your own age group. That makes you feel elated, releases the happy hormones. So that will keep you healthy in all ways. So you will be looking forward to this. Actually, I myself do these things. Like, I'm a marathon runner, and
Wow.
I go to gym, I play badminton. So these things will help me to maintain. I hope that when I reach your age group, I should be able to maintain tied with these things. And of course, do develop hobbies like, traveling, or whatever you like, singing or playing. There is never age key. I should not do something at this age. You should never have that. You can start anything anytime. Just see what you like and you do.
Very, very well said, Dr. Padmalatha, for this. One last question that has come in is if I do have osteoporosis, is
Hmm.
it okay to be doing weight training?
Yes, very much important. But you should do it in a very gradual way and care. If you do weight training, your osteoporosis will reverse. And the advantages of exercises is two things. One is to protect your bones. Second is to maintain your balance so that you will not fall. That is very, very important in these age people. So when you are walking, that stability is important. When you are doing anything, that stability will help you to prevent falls. And that stability will come if your muscles are strong. Muscles will be strong only with weight training.
Right. Very, very well said. And would you say that, would you give a threshold of, okay, you should not be, doing weights of above a certain level? Is that something that you would be able to say?
No, no, it's nothing like above certain level. You should listen to your body. You should go gradually. It's not necessary that you should do some, 20 kgs, 30 kgs deadlifts, this, that, and all that. Do simple weight training, and that you can start with 1 kg, 2 kg, 3 kg, and more reps and lesser weights will be more better to prevent injuries. Preventing injuries is very important when you start any new activities, so including walking. So when you are walking, you should wear comfortable footwear. If you don't wear comfortable footwear, obviously your posture will be wrong, and you will get back pain, and then you will think that, oh, I went for walking, that's why I got this. So that should be changed. You should wear the appropriate apparel. You should go in a, say, if you're starting weight training, go with a trainer. Go to a gym where they will help you out with what you should do and what you should not do, how you should not do. So that way you will prevent injuries and you will improve your health overall.
Right. Doctor, we have a lot of people from South India also joining us here. So would you like to say something which other language you're comfortable with, Kannada or Tamil or whatever, just for
Yeah,
our,
everything. Kannada, Telugu. Yeah.
okay, so something in Kannada for our people. There are a lot of people from Bangalore who are there. Yeah.
ಹಾ. ಸೊ ಎಲ್ಲರೂ ನಿಮ್ಮ ಹೆಲ್ತ್ನ ಚೆನ್ನಾಗಿ ನೋಡ್ಕೋಬೇಕು. ಅದಕ್ಕೆ ಸಿಂಪಲ್ ಆಗಿ ಆ, ಊಟ ತಿಂಡಿನಲ್ಲಿ ಏನು ಕಾನ್ಸಂಟ್ರೇಟ್ ಮಾಡಬೇಕು ಅಂತಂದ್ರೆ, ಟೈಮ್ ಟು ಟೈಮ್ ತಿನ್ಬೇಕು. ನಾನು ಬೆಳಗ್ಗೆ ಎದ್ದ ಮೇಲೆ ರಾತ್ರಿ ಮಧ್ಯಾಹ್ನ 12 ಗಂಟೆ ತನಕ ತಿಂಡಿ ತಿನ್ನಲ್ಲ, ಆ ಥರ ಮಾಡ್ಕೋಬೇಡಿ. ಟೈಮ್ ಟು ಟೈಮ್ ತಿನ್ನಿ. ಆ್ಯಂಡ್ ನೀವು ನಿಮ್ಮ ಹೆಲ್ತ್ನ ಕಾಪಾಡ್ಕೊಳ್ಳೋಕ್ಕೋಸ್ಕರ ಹೆಲ್ತ್ ಚೆಕಪ್, ಶುಗರು, ಬಿ ಪಿ, ಇದೇನೇನಿರುತ್ತೋ ಅದನ್ನು ಸರಿಯಾಗಿ ಕಂಟ್ರೋಲಲ್ಲಿ ಇಟ್ಕೊಳ್ಳಿ. ಎಕ್ಸಸೈಸ್ ತುಂಬಾ ಇಂಪಾರ್ಟೆಂಟ್. ಯಾವ ಏಜನಲ್ಲಾದ್ರೂ ಒಂದು ವ್ಯಾಯಾಮ ಅಥವಾ ಎಕ್ಸಸೈಸ್ ನೀವು ಕರೆಕ್ಟಾಗಿ ಮಾಡ್ಕೊಳ್ಳೋದನ್ನ ಅಭ್ಯಾಸ ಮಾಡ್ಕೊಂಡ್ರೆ ನಿಮಗೆ ಹೆಲ್ತ್ ಮೇಂಟೈನ್ ಆಗುತ್ತೆ. ಒಂದು ನಿಮ್ಮ ಬಾಡಿ ಮೇಲೆ ನಿಮ್ಮ ಕಂಟ್ರೋಲ್ ಇದೆ ಅಂತಂದ್ರೆ ನಿಮಗೆ ಅದು ಎಷ್ಟೋ ಚೆನ್ನಾಗಿ ಅನ್ಸುತ್ತೆ. ಇಲ್ಲಿಂದ ಈ ಪಕ್ಕದ ಶಾಪ್ಗೆ ಹೋಗಿ ನಡ್ಕೊಂಡು ಹೋಗೋಕೆ ನಿಮ್ಗೆ ಕಷ್ಟ ಆಗ್ತಿದೆ ಅಂತಂದ್ರೆ ಆಮೇಲೆ ಬೇರೆಯವ್ರ ಮೇಲೆ ಡಿಪೆಂಡೆನ್ಸಿ ಬರುತ್ತೆ. ಅದು ಇರಬಾರ್ದು. ಯಾವತ್ತೂ ಯಾರ ಮೇಲೂ ಡಿಪೆಂಡೆನ್ಸಿ ಇರಬಾರ್ದು. ಅದು ಇರಬಾರ್ದು ಅಂದ್ರೆ ನಮ್ಮ ಬಾಡಿ ಶರೀರದ ಶಕ್ತಿನ ನಾವು ಕಾಪಾಡ್ಕೋಬೇಕು. ಅದಕ್ಕೆ ಎಕ್ಸಸೈಸ್ ಇಸ್ ದ ಬೆಸ್ಟ್ ವೇ.
Shall I say ಧನ್ಯವಾದ?
ಧನ್ಯವಾದಗಳು.
Thank you very much. Thank you very much, Dr. Padmalatha. Thank you to the SPARSH group of hospitals to have facilitated this. It is these words of advice that our seniors require from you, and you've said it very, very well. Seniors today conducts these health webinars every Saturday at 5 p.m. and I can see that there are around over 700 people who are watching on YouTube. Do watch it on YouTube, but remember, if you want to ask questions live to Doctor, like we have Dr. Padmalatha today, we have somebody else next week. You must come live on Zoom, and you can ask these questions live. There's nothing like asking a question live and getting it there and then. As you all know, Seniors Today has just completed 5 years. Recently, our anniversary issue has just been published in the July issue. We are working on the August issue, which is going to be an Independence Day special, and it's on the 15th of August, and the 15th is the date of the issue. So we'll be there. Our next 16th season of Seniors Have Talent is starting in September. We are doing a live event later next week, which is part of our sibling Giftex, which is going to be there in Mumbai. So if you want to attend a live event of senior citizens, do drop in a line at our events email ID, and we will send you the details of our live event, which is happening at Nehru Center in Worli in Mumbai. So you can do that. There's a host of events happening. There's the Evergreen Club, which is there. As you all know, there's morning, afternoon, and evening. There are quite a few events that are there, and they're all free of cost. So you must use this opportunity to be there. I've just had my producer saying 7th and 8th August, at Nehru Center, 11 a.m. to 6 p.m. We have somebody, let me sign off with thing, saying that thanks to doctor, she's given us very important information very nicely. Thank you. Dhanyavada, as I will say in Kannada again. And thank you once again, and see you again next Saturday at 5 p.m. for another session of Health Live at Seniors. Thank you.
Thank you.
Subscribe now and press the bell icon. Never miss an update.